news comes first. This is ABC-7 Extra.
Good evening, I'm Saul Saenz, and this is ABC-7 Extra Sunday Edition. I want to thank you for permitting us into your homes. COVID-19 deaths across the borderland are down, as are hospitalizations. In El Paso, vaccination rates are almost at 77%, the closest we've been to what health experts considered herd immunity. That's the good news. The bad news is COVID cases among children are going up. That could be because a COVID vaccine for children is yet to be approved. According to government health officials, that may soon change with the possible emergency use approval of a vaccine for children within the next few weeks. How the vaccine will be rolled out and put into the arms of children between the ages of 5 to 11 years old is the topic of tonight's Sunday Extra. I reached out to school districts as well as Immunize El Paso to let us know how that process will be achieved. Neither El Paso, Socorro, Isleta, or Canutillo independent school districts were able to provide a representative for tonight's program. To be fair, those ISDs do not vaccinate their students. And according to information released by Pfizer, children make up 22% of the nation's population. That same information shows children under 18 make up 27% of all new weekly COVID-19 cases, with thousands of children being hospitalized with a potentially fatal virus. The FDA is on the cusp of approving a Pfizer vaccine for children, possibly by as soon as early November.
Frankly, it's an embarrassment in a developed country to have even 100 children like we've had die of an infectious disease that's preventable.
According to the Centers for Disease Control, COVID-19 has killed more than 600 children in the U.S. Pfizer is gathering and reviewing data surrounding a COVID vaccine for children between the ages of 5 to 11 years old. Right now, Pfizer is waiting for authorization for the vaccine. Health experts are reviewing data released by Pfizer showing lower doses of their vaccine is effective among children in that age group.
We don't want to prejudge the data. We have to look at the data. Safety comes first.
Federal health officials are telling governors of states they could release a COVID-19 vaccine for children by as early as November. Reports are the Biden administration has already purchased 65 million doses of the Pfizer vaccine, enough to vaccinate an estimated 28 million children. The head of Immunize El Paso tells ABC-7 that organization is ready to roll up its sleeves and work with school districts to put shots in the arms of children in that age range as soon as the vaccine is available. While the feds may approve a vaccine for children, the question is if parents will approve of their children being vaccinated. Opinions are mixed.
I don't think I would. I think I myself am vaccinated, but I'm a little bit older.
You know, as a parent to a 4- and 6-year-old, it's something that we've been waiting for since we got vaccinated. So it's something that I feel comfortable with.
No, I don't want my kids to get the vaccine.
And can I ask why?
I don't trust it.
Well, I think if the CDC has established the fact that it's safe, I'm vaccinated fully. I think that we should take their advice.
Again, opinions are mixed. Joining us now to talk more about vaccines for children and how they would be rolled out is the head of Immunize El Paso, Dusty Wharton. Immunize El Paso is well experienced with vaccinating hundreds of thousands of borderland residents. Also joining us is El Paso Health Authority Dr. Xtra Carranza. Dr. Carranza is also a pediatrician. So I have to ask you, Dusty, what would the rollout of vaccines for children look like here in the borderland? And who would you have to coordinate to vaccinate 5 to 11-year-olds?
Well, it would require an all-hands approach. Obviously, we have thousands of eligible children who would be recently introduced the idea of getting vaccinated against COVID-19. El Paso has done a wonderful job of rolling up its sleeves and getting protected. As you can tell by the 75% number that we've reached, it's a huge benchmark, and it's a great boon for the entire neighborhood or the community. And the highest in Texas. That's the point of this. With that said, it'll be an all-hands approach by a multitude of providers, ourselves included. No single entity could have handled this by themselves. So with the various providers, whether it be the city, the county, private providers, nonprofits such as ourselves coming together and coordinating an approach, we'll be able to have the best impact and increase accessibility to the vaccine better than anyone else could.
Yeah. As of Friday, I checked El Paso Strong. As of Friday, the vaccination rate is 76.7, so we're very close to 77%. But Dr. Carranza, do we have any idea what the COVID positivity rate among children is in El Paso?
Well, what we have seen is that we have children that steadily are testing positive for COVID-19. But what is more important to highlight is that a lot of these children are positive because their whole household is unvaccinated and also become positive. So many people are fearful that our children are going to be infected in the schools. The schools are doing a wonderful job in deploying their safety plans, in keeping everybody safe. But unfortunately, if we have a household that is unvaccinated, then that puts them at risk in developing the COVID-19, either just infection or the whole spectrum of the COVID-19, which concerns us as pediatricians and as healthcare professionals, because we know that there's the specific syndrome within children that could be very, very severe, called multi-system inflammatory syndrome of children, which affects multiple organs. It can happen 4 to 6 weeks after they've been exposed or they were infected with the COVID. So we need to be very cognizant about that. And vaccination has been proven to be the safest and most effective way to prevent infection and some of these complications.
So we don't have a positivity rate, but do we know if we have any children in El Paso who are hospitalized with COVID-19?
Yes, definitely. We see that children get hospitalized with COVID-19, even though it's not going to be the same amount of patients that we have as adults, but still, we see children getting hospitalized with COVID-19.
And your thoughts on the COVID-19 vaccine for children ages 5 to 11? Have you heard anything down the road that we might be getting that vaccine soon?
Well, it is a great development to have all the testing and all the safety profile for the vaccine for the children, especially for 5 to 11-year-old. A lot of the parents are asking us, when are we going to be having the vaccine available for this age group? And I'm very positive that the acceptance of the vaccine in this age group is going to be great. The same way I congratulate and I really thank all of you that have received the vaccine up to now. Please, that's a great start, and that's the way that we stick together as a community to continue moving forward against this pandemic.
And Dusty, you've heard Dr. Carranza talking about how important it is to vaccinate children, especially when they're in households where no one is vaccinated. Have you been hearing anything, or are you going to be hiring any more people to help you out with the vaccines for children?
Well, right now, we're currently engaged in our third dose and booster dose campaign for COVID-19, as well as a very well-developed influenza vaccination campaign that encompasses multiple school districts and visiting various campuses. So that staff will transition off of flu and move into COVID adolescent vaccines or child vaccines, probably beginning November, assuming we get the right approvals. And for those that are vaccine hesitant, we have to understand that despite the fact that COVID-19 is less prevalent in children, it is still 3 times more deadly than influenza. We're very familiar with getting an influenza vaccine and offering it for children. This should be no different. In fact, we should have a higher emphasis on encouraging the parents of children to opt into vaccination.
And Dr. Carranza, in the 30 seconds that I have left for this particular segment, what would your best advice be for parents who are on the fence, not really understanding what the vaccine for children is, or whether or not they need to get it?
Well, we try to educate the parents and tell them and put on the table what are the risks, what are the benefits, and what does it mean to immunize your children. And this is not only for the COVID-19 vaccine, but for all vaccines that we offer for infants and children. So COVID vaccine is another one of the tools that we're going to have, and another one of the vaccinations that we're going to be having for children. And it's going to be the last piece that we have to continue making this robust response against the COVID-19 pandemic. So we already started with the people that were most vulnerable to the COVID, which is these elderly, the people that resided with long-term care facilities. We moved also to the people that have chronic conditions, and there's definitely children with chronic conditions that will benefit from the vaccination.
Got it. You're watching ABC-7 Extra Sunday Edition. When we come back, I'll ask Dusty Warden and Dr. Carranza if people who would be in charge of vaccinating children need any special training. But before we go to break, ABC-7 asked parents if they would want their children vaccinated. This is ABC-7 Extra Sunday Edition, where news comes first.
I think we should protect the children from getting COVID, and I think it's a good idea for them to get it. Science has proved that it's safe, and I think that to protect the children, they should have it.
I believe kids shouldn't get it, like they have a better chance of fighting it as opposed to adults. And there's still not so much research for the vaccine yet. That's for kids, you know.
You can count on Bravo Chevrolet to bring out the big guns and save you more! Like a new Chevy Silverado with explosive discounts! We'll take anything on trade. I'm a veteran, and veterans are always welcome at Bravo Chevrolet. Who are we? Bravo!
Night, Sarah.
Drive safe. Bye.
Drive safe.
Okay.
Bye-bye, Mommy. You guys ready?
Sure you got everything? Drive safe.
We all say it. Chevy can help you do it. The Chevy family of SUVs. Find new peace of mind. Find new roads.
Very well qualified buyers can get interest-free financing for 72 months on select popular SUV models. Chevy drives Texas. Find new roads.
Looking to shift into an electric vehicle? El Paso Electric can help. We're your resource to learn about EVs, special charging rates, and potential incentives. Choosing an EV opens the road to a cleaner future with zero emissions on pure electric power. Plus, EVs give you a smoother and quieter drive. Driving green can save you some green. With a lower need for maintenance than gas engines and a charging rate that's about half the cost of gasoline. There are so many reasons to go electric. Get started today at epelectric.com/EV.
Spin class was brutal. I bet. Hey, don't forget to check your blind spots.
No worries.
Can I use Apple CarPlay to put some music on?
Sure, it's wireless.
What's your Buick's Wi-Fi password?
It's Buick Envision.
That's a really tight spot. I used to hate parallel parking.
Me too.
The all-new Buick Envision, built around you, all of you.
Pay no interest, plus current eligible Buick owners get $250 purchase allowance on 2021 SUV models. Or get $1,000 purchase cash on this 2021 Buick Envision Preferred.
Welcome back to ABC-7 Extra. I also want to welcome back Dusty Warden with Immunize El Paso, as well as El Paso Health Authority Dr. Xtra Carranza. Once again, I did invite representatives from our 4 major El Paso independent school districts. None were available for this broadcast. Before we went to break, I asked the question, do people who would vaccinate children need some sort of special training? Dusty?
So all of our immunization technicians are certified as medical assistants, emergency medical technicians, and we have a medical director on staff who provides us this guidance. That said, there are the precautions that we want to take, and the biggest training that all of our providers need is patience with children. It requires a little special care. Children are inherently afraid of needles, and so we need to use education and compassion and a caring approach to make sure they're receptive towards it. Parents are a big part of that. Having them on site eases that, and they help us through the immunization process. But we're also prepared for in the unlikely event of an adverse event. We have the tools and equipment and materials necessary to respond to those types of crises.
Yeah, it's not, I imagine, I'm assuming, of course, that it's not that easy trying to sit someone down and trying to give them that vaccination, especially if they see that needle. How are you coordinating, or how will you coordinate with the school districts to get children vaccinated?
And so we've already had discussions ongoing for quite a while on taking a campus level approach to make immunization available in every community. And so that's multiple school districts. Also, we'll be doing pop-ups or outreach locations, as well as our brick and mortar locations. And that's just our approach. And we know that other entities will be doing a variety of other campaigns to make sure that we get the vaccine out as well. That said, having the schools and having their known representatives reach out to their communities, their parents, their community organizer to encourage vaccination is a very strategic and important tool to develop trust and to get people to come get vaccinated.
Yeah, Dr. Carranza, we've been told COVID-19 or some variation of it will be around for a long time to come. Do you think we will ever see the day when vaccinations for COVID will be required for children before the first day of class, say maybe like the measles or other viruses?
Well, definitely it's going to be added to the whole immunization schedule that we're going to be having. We will continue to see COVID, and COVID came to stay, and it's going to stay in our community all the time. We're going to be having to see some endemic levels, meaning that we're going to be having to have a specific amount of cases that it might increase during the winter, it might be a lot lower during the summer, but it's going to be added to the, again, the immunization schedule that we're going to be having within the state of Texas and the laws. There's always allowed some exceptions, either for conscious objection, religious reasons, etc. That could be considered an exception to having the vaccinations. But with our community, our experience is that we embrace vaccines. We know the good that the vaccines have done, and we have the most powerful influence, which is our grandmothers, our matriarchs, patriarchs, those older individuals that live with us that have seen the deleterious effects of vaccine-preventable diseases when they were growing up. That is one of the secret weapons that we have that also has a big influence in why we are so receptive of the vaccines. As Mr. Warren has said, our community has been successful because of the collaboration of many, many, many organizations. And bringing the vaccine available to the community is one of the strategies that has worked well, making it very accessible and free.
Yeah. Also, I wanted to ask you about the school districts, because I know that some of the school districts are not mandating the mask use. Would it be fair to say that the rate of children getting COVID-19 went up as soon as school started, and of course the dropping of the mask mandate?
Well, what we had seen is that the rate of COVID-19 in school-age children was going up. As we put the mask mandate, the rate started going down. We will continue to strongly encourage everybody to send their children to school with a mask. The mask is very simple to wear. It is a very good preventive way that not only for COVID, but for many other respiratory viruses. Last flu season, just to give an example, we decreased the flu by 96%. That is outstanding. We hardly saw any influenza, but with this new year, there's going to be new challenges, and this is going to be one of those. But washing your hands, and teachers teaching our children to cover the cough, and parents, if their kid is sick, just keep them at home. Simple ways, and once the vaccine is available for their age group, vaccinating them. All the combination of different factors is going to keep our children safe. Our whole household is going to be a lot healthier, and it's going to be a very successful flu or winter season.
Yeah, you know, we have Halloween coming up. What are your recommendations to parents who are going to be taking their kids? Do you think the kids, while they're out trick-or-treating, should be wearing a mask? And this whole idea of reaching into a bag to get candies, what are your thoughts on that, doctor?
Well, there are very creative ways to wear a mask, to wear your costume, and also having to trick-or-treat out in the outdoors is a lot safer than indoors. If you choose to wear your mask, great. I know that there's going to be also some senior citizens handing out candy, and there's ways that they can also protect themselves, that they can wear their masks when all the people come to their houses so they can give the candy. Everybody is strongly encouraged to receive the vaccine before this. But one thing that I want to mention is that we need to be very cognizant, because it's taking a trend now that some children with special needs are going to be having some pumpkin baskets with a different color. So talk to your neighbors, talk to those parents of those children, so they can schedule maybe a time where they can come and do trick-or-treating away from the big number of children coming, because a lot of these children, especially the children with autism, are going to be having problems with large crowds. So before the large crowds come to the neighborhood, let's schedule something for them. Let's keep that very special holiday for these children. And also for the rest of the children, just practice prevention. We're going to continue to emphasize the practice prevention. After going trick-or-treating, wash your hands, don't touch your face. And the mask also helps remind children and even adults not to be touching their face. The face is always the biggest door of entrance to many, many, many diseases.
Good recommendations. Now, you're watching ABC-7 Extra. Still ahead, I'll ask my guests about the potential side effects a children's vaccine might have. Before we go to break, ABC-7 asked parents if they would have their children vaccinated against COVID-19.
Being a mom, being somebody who also took the vaccine, used to be employed with the school district, so seeing in an elementary school, And I think that the sooner we could get these kids vaccinated, the safer we'll feel as a community. And I anxiously, too, look forward to being able to get my children vaccinated.
Well, I have my different take on that. I mean, I'm all for the vaccine, but I just think that there's not enough, research on it. Time, it hasn't been long enough for those children that small. I just feel like maybe we need to since it hasn't, I mean, I know it's affected children, but I think they're able to fight it off a little bit better than adults are. So I just feel like maybe we need wait a little bit longer for research on it before we start vaccinating the younger. I have 6 grandkids that are between the ages of 1 and 12. So I'm still a little leery.
With the right team behind you, it's easy to win. That's why our team at Casa Buick GMC always gives you outstanding savings and service.
Get any new 2021 Buick SUV with 0% APR financing for 72 months.
And with our unprecedented trade-in value, it's easy to score on your new ride. We're giving you more than ever before, so come see us first.
Get MVP savings at Casa Buick GMC. Home of the Nice Guys, an official partner of Locomotive Soccer.
Think premium can't be capable? Think again. Introducing the first ever AT4 lineup. Premium and capable. That's professional grade from GMC.
Or get $2,000 purchase cash on this 2021 Sierra Light Duty Crew Cab Texas Edition. Plus, current eligible GMC owners get an additional $250 purchase allowance.
The unknown is not empty. It's a storm that crashes and consumes, replacing thought with worry. But one thing can calm uncertainty: an answer. Uncovered through exploration, teamwork, and innovation. An answer that leads to even more answers. Mayo Clinic. You know where to go.
Oscar Leaser's Hyundai of El Paso has new inventory arriving daily. Our 2022s are pulling into the lot now, like Elantras and Sonatas, Konas and Tucsons, Santa Fe's and Palisades, even the all-new 2022 Santa Cruz, the best of an SUV and pickup truck combined for a truly one-of-a-kind vehicle. All available with zero down. That's zero down on 2022 models, and interest rates as low as 0.9% APR for 60 months. 2022s are here at Oscar Leaser's Hyundai of El Paso.
Welcome back to ABC-7 Extra Sunday edition for this third and final segment. I also want to welcome back Dusty Warden with Immunize El Paso and El Paso Health Authority, Dr. Xtra Carranza. I'm going to start with you once again, Dr. Carranza. What will your role be when immunizing some of these children? Once the vaccine is available, obviously.
Well, once the vaccine is approved for this specific age group and children 5 to 11 years old, we authorize the clinics, we sign the standing delegation order so the vaccine can be given according to what the recommendations from the CDC and the state are. And Mr. Warren says, we also train the people to give the vaccination in the safest, proper way that it is recommended. We always appreciate the support of the parents because the parents can provide the comfort, can provide a lot of the safety measures that we need to have in place to give and deliver the vaccine in a safe manner.
Dusty, you touched upon this earlier. It's not just at schools where children will be immunized against COVID-19. Talk to me more about some of the other events, the pop-ups that you were referring to.
So we've been partnering with other organizations to stand up pop-up immunization clinics at very atypical places, whether it be a movie theater, a gym, a local coffee house, where perhaps somebody who would just be walking by would think, you know what, there's no line, let me just get vaccinated if I haven't done so yet. And so it's worth that effort just to get 1 or 2 households the additional protection that they might not have already. And so be on the lookout, and there's plenty of organizations that are offering it, ourselves included. And even then, those that really wanted to get vaccinated have done so. So this is reaching out to a completely different population to where they just had a second thought about it and it's like, you know what, I'll do it. This is convenient.
Yeah. The preliminary, at least the target date that we've been given for these vaccines for children to come out is November 3rd. Has anyone reached out to you, either the state or the feds, to let you know that some of those vaccines for children will be on their way?
Yes, we as a provider group have already been in contact with the Texas Department of State Health Services to submit preliminary data of what our initial censuses will be. We don't have dates, but we do know that vaccine delivery will be imminent. And so the presentation will look a little bit different from the provider standpoint, how we identify a pediatric dose versus an adult dose. And so we've already begun that training rollout for our staff. So we're already in compliance and submitting that necessary information so we can be eligible to receive vaccine as soon as it's available.
When that happens, what should parents know? What documents do they need to bring? What information do they need to bring when they're going to vaccinate their children?
So it's a very simple process. We'll need a parent's consent in order to provide immunization for children. Ourselves, we've gone to a digital process to where parents can sign up online, provide all the information. If they have health insurance, we'll take that data. If they don't have health insurance, not a problem. It's still free, and with the ultimate goal of getting children immunized. And if anyone has any technology issues, we have staff who can register over the phone, or they can walk into our clinics and we can help them through that process. Again, eliminating any potential barrier to immunization.
Dr. Ocaranza, what are the possible, at least to your knowledge, what are some of the possible side effects a child might have to these COVID-19 vaccines?
Well, the most common is going to be that reaction that the older kids also are experiencing, that sometimes they might have some body aches, some fevers. It is going to be more widely available, the trials that the companies have done in these children 5 to 11 years old, so we can have a complete list of what could happen. And also that's going to be part of the information that the parents are going to receive when they come and request the vaccine for COVID-19. But again, we're going to be having all those channels to listen to any specific signals, looking for any specific side effects that were not reported during the trials. One of them is called the Vaccine Adverse Event Registry, in which parents or providers can submit the report of an adverse event due to the vaccine or the possibility that it was from the vaccine. And also, they can talk to their healthcare provider about that, and they can submit the report. So we want for those parents to be confident that the vaccine that their children are receiving is safe, is going to be effective, and it's, again, the right decision to make.
So what should parents do if they see some of these side effects, or the ones that you mentioned that may not have been listed, that could come from the COVID-19 vaccine? What should parents do if they start seeing some of those side effects?
Well, first, they can contact their healthcare provider. They can contact their pediatrician and let them know, hey, maybe this is not something that we discussed during the visit when they were giving the vaccine. I want to make you aware. Another thing that a lot of the parents do before giving the vaccination is provide medications. You can wait before you give the medication before the vaccination and give it after in case they have any. But one thing that is important to mention is that many people after receiving the vaccine does not have any reaction whatsoever, and there's nothing to be afraid of. And that is one of the reasons why people don't get the vaccine, because they have seen some other people having those reactions that are short-lived, 24, 48 hours, and it's going to be gone. But most importantly, be confident that when you're receiving or when you're having the COVID vaccine in your children, everybody wins. Your children is going to be healthier. The possibilities of adults going to the hospital because of COVID-19 are going to be very, very greatly decreased, and everybody's going to be able to celebrate the holidays.
Dr. Hector Ocaranza, El Paso Health Authority, Dustin Warden with Immunize El Paso, thank you so much for taking time to talk to us on this Sunday evening.
Thank you.
Thank you, Ron.
And I want to thank you, folks at home, for taking time to watch this and to get all of this information, very helpful information. I'm Saul Saenz, and this has been ABC-7 Extra. Good night y buenas noches.